Hi everyone, I'm Peter Meliaris, a physiotherapist and professor specialising in tendinopathy for more than 20 years and the first ranked tendinopathy clinical expert worldwide according to the website ExpertScope. If you're like most patients with Achilles pain, you probably find it hard to know which online sources of information to trust. Don't worry, I specifically made this video to provide you with everything you need to know to recover from Achilles tendon pain. To make it easy to follow, this video is in 3 parts. Part 1 will cover why your Achilles hurts. In part 2, I'll discuss how to help your Achilles tendon recover. And in part 3, we'll go into what to expect along the way. I recommend watching it all. It will be time well spent for your Achilles. You can also use the timestamps to jump to different sections if you like. If you find this video useful, please feel free to share it, hit the thumbs up or subscribe for more tips on tendinopathy. I'd love to hear your questions or comments, so please drop them in the comments section below. I'm sure you have lots of questions about your Achilles pain. Let's try and address these one by one. The Achilles tendon is one of the strongest tendons in your body. It's named after the legendary Greek hero Achilles, whose heel was his only vulnerable spot. The interesting thing is, your Achilles tendon is far from vulnerable. It acts like a strong rope between your calf muscles, the gastrocnemius and the soleus, to your heel bone. Knowing how your Achilles works is the first step in addressing Achilles pain. Your Achilles tendon has 2 jobs. First, it helps you to move. When you walk, your calf muscle tightens and the Achilles tendon transfers the strength from your muscle down to your foot so you can walk and run. Second, think of your Achilles like a super spring in your ankle. It absorbs energy as you walk or run, then releases it back. This helps you walk or run longer without getting tired. When you're walking or running, your Achilles is actually dealing with a lot of weight, about 3 to 5 times body weight when you're walking and even more when you're running. For example, if you weigh 70 kilos, your Achilles might be handling over 300 kilos just during walking. Usually it does it really well, but sometimes it can get overwhelmed. We'll talk about how this happens later. Achilles tendinopathy is the special name for pain in your Achilles tendon. A while ago, I worked with a large group of experts from around the world. We agreed to call this pain Achilles tendinopathy. You might sometimes hear other names like Achilles tendinosis or Achilles tendinitis. Maybe a doctor said it or you saw it online. Our expert group voted not to use these names as they can be a little bit confusing. They might make people worry more than they need to, or think the problem is all about inflammation. That's what the itis part usually means. While there is a bit of inflammation in tendinopathy, it's not the entire picture. Some might think just resting or taking medication for inflammation will make it better, but unfortunately, it's not usually that simple. The main thing you'd notice if you had Achilles tendinopathy is pain right on your Achilles tendon. This pain could be down near your heel, that's called insertional Achilles tendinopathy, or in the middle of your tendon, that's called mid-portion Achilles tendinopathy. Usually you feel this pain when you're doing things that make your Achilles work really hard, like walking, running, or playing sports. It becomes really noticeable if you run or walk fast or up hills because the tendon has to work harder. It's common for the pain to show up when you first start to move after sitting for a while, or when you get out of bed. Normally the pain gets better after you move around for a few minutes. But if you have more severe Achilles tendinopathy, it might stay or even get worse when you're active. Or it might be so bad that you can't do some activities. But don't worry, we'll explore ways to help your Achilles tendon problem recover in part 2. Achilles tendinopathy doesn't have just one cause. It's often due to multiple causes combining together. Understanding these causes is the key to your recovery. Think of it this way. The pain in your Achilles tendon is linked to how well you as an individual can cope with challenges in your everyday life. Some of these challenges take the form of activity. It's good to keep active, but if you suddenly do a lot more exercise like running or walking, this can contribute to Achilles tendinopathy. Common examples include adding fartleks or intervals to your running workouts, or starting to walk regularly with a friend who walks much faster than you. Also, if you haven't been active for some time, starting activity again can cause pain. This pain happens because your body isn't used to being active, which is called deconditioning. If you can't recall a change in your activity, you might be wondering why you have Achilles tendon pain. The answer is that pain isn't just about the activity levels. Your ability to handle challenges is influenced by several factors in three main groups. This includes body-related factors like extra body weight, emotions and thoughts such as stress or worry, or your social environment and lifestyle habits like not getting enough sleep. There are lots of other examples in each of these groups as well. The important thing is, when it comes to treatment, we need to look at you as a whole person and consider how these different parts fit together. I'll explain some more about this in part 2. Weak muscles, flat feet or tight calf muscles are often thought to cause Achilles tendon pain, but they're usually not the main factors. Focusing solely on these aspects might not help. The calf muscle may be weak and need attention, but this is usually a result of the condition, not the initial cause. It's important to know that for some people there are medical reasons behind your Achilles tendon pain, like certain health conditions or medications you're taking. If you're unsure if these factors could be part of your Achilles problem, it's a good idea to talk to a health professional who knows about tendon problems. Understanding Achilles tendon pain can be confusing. Scans often show changes in the tendon in people with pain, but interestingly, the same changes are also found in people without pain. This means that the changes seen on your scans can't really be the cause of your pain. Pain is more complex. There are two things to consider here. First, other things going on inside your tendon that we can't see on scans might be contributing to your pain, like tendon cells creating substances that lead to pain. This is why your Achilles might feel tender when you squeeze it. Second, remember that your pain isn't just about what's happening inside the tendon. It's also influenced by body-related factors, emotions and thoughts, and social environment and lifestyle habits that we discussed before. There's a critical lesson from this that I want you to take away. Pain doesn't always match what's seen on scans. It's not a direct sign of tendon damage. So feeling pain or even a sudden increase in pain doesn't necessarily mean you're harming your tendon. It's okay to feel a bit of pain while being active. The best way to figure out if you have Achilles tendinopathy is by seeing a health professional who will ask you questions and perform some simple tests. If you just use scans, you might end up treating things shown in the scans that aren't actually causing your pain. Also, most of the time, changes on scans remain even when your pain gets better. So fixing these changes isn't needed to get better from Achilles pain. Your health professional might ask for a scan to look for less common problems, but this is only if your Achilles pain is not typical. Worrying about an Achilles tendon tear or rupture is really common. But if you're experiencing pain, it's really reassuring to know that it's very unlikely to tear or rupture. Most ruptures occur without prior pain. People that persist with activity despite pain usually don't experience a rupture, reinforcing that pain doesn't necessarily signal damage. However, ignoring the pain isn't good either, as it can delay recovery. I'll talk more about this in part 2. People also worry about changes found on scans like tears and delaminations or splits. These words sound scary, but for a vast majority of people, it's not as bad as what it sounds. People often worry these tears will get worse if they are active, but this rarely happens, and the presence of tears on scans doesn't generally alter treatment or recovery. A good health professional can determine if a tear shown on an Achilles scan is something that you need to worry about, which is rare. Usually, there has been a major event causing a sudden pain worsening, like sprinting to avoid a bus. If you're not sure about your Achilles scans, please see the links in the description below for more specific help. Also, please share your experiences or other worries you have about your Achilles pain in the comments section below. In part 2, we're going to change focus to all the things you need to know to recover. Recovery from Achilles tendinopathy isn't about a single treatment. It involves trying different approaches, including exercise and lifestyle changes. Imagine these as switches you can turn on to help your recovery. Also, bear in mind the best person to take control of your recovery is you. To get better, you need to understand what to do, make a plan, and try and stick to it. Health professionals can guide you, but be aware that not every treatment you come across is recommended. That's why it's really important for you to be proactive and equip yourself with the right knowledge. Calf exercises can help Achilles issues, but don't work for everyone. Treatments like anti-inflammatories and night splints have been found to be ineffective for persistent Achilles tendinopathy. The same goes for PRP or platelet-rich plasma injections. Even though they are commonly recommended, they have been shown not to be effective. Steroid injections may help in the short term but could make your Achilles problem worse in the long run. Some people report benefit from things like heel wedges, massage, acupuncture, dry needling and shockwave therapy, but we don't have enough research evidence to really know if they work. They're generally safe and affordable, so trying them is okay. However, I would recommend that you spend most of your effort on what I call a sensible active approach. Let's discuss this now. A sensible active approach involves 5 things you can do to effectively manage your Achilles pain. Number 1, check if your activity is affecting your Achilles and take action. It's really important to check whether activity triggers your pain and adjust these activities in the short term. Sounds complex, but it's not that hard. Here are the steps you need to follow. 1, list the activities. Write down everything that might stress your Achilles, like walking, running, or playing sports. You can track what you did last week or keep a diary for the coming week. 2, rate your pain during these activities. Was it mild, moderate, or severe? 3, monitor pain after these activities. It's normal for it to increase, but it should get better within a day. If it lasts longer, the activity might be too much right now. To know if the pain got worse for more than a day, track the pain over time with activities that usually cause pain, like your regular walk, a calf raise, or even doing a small hop. Don't worry so much about pain when you first start moving after resting, or if you press on your Achilles and it feels sore, as these don't always match up with pain during activity. 4, work out if the pain during and after activity is too much. Pain should be acceptable to you during activity. For most people, this is mild or up to moderate pain. Severe pain is too much. If you do an activity and experience increased pain with your usual activities, or the calf raise or hop tests for more than a day, this is also too much. 5, if the pain is too much, adjust your activities. First, reduce the most intense activities like walking or running fast or intense sports. If there's still no improvement, think about doing the activities that are a problem less often. If your job requires you to be on your feet a lot, like nursing or gardening, it might be hard to reduce your activity. Consider using supportive shoes or insoles, and in some cases a special boot for extra rest. Number 2, remember modifying activities is temporary and always replace them with less stressful options. If you do reduce your activity due to your Achilles problem, replace it with low impact exercises like cycling, swimming, or using an elliptical. Otherwise, you might lose fitness or gain weight, which can slow down your recovery. Also, plan for a gradual return to usual activities when you notice that the calf raise and hop tests we discussed and your usual activities are not too painful. You can test this every few days, and remember it can take a few weeks to improve, so be patient. Number 3, consider and address common activity problems. Achilles pain can trap you in a cycle of discomfort if you're not careful. I'm going to explain common activity problems and what you can do to get out of them. Problem 1, persisting with activity. You may be persisting with activities despite experiencing a lot of pain. This eventually leads to frustration and loss of enjoyment in being active. This could mean that you need to take a break from painful activities, often for a few weeks. I know it's hard to cut back on activity, especially if being active is a big part of who you are, but sometimes your body needs that break to recover. Problem 2, avoiding activity. If you're avoiding activities due to fear of worsening your pain, this can lead to a cycle where inactivity makes even simple tasks painful. This reinforces your belief that you shouldn't move too much. Try this instead. List activities you feel might worsen your pain and rank them from easiest to hardest. Then start experimenting with the easiest ones first and gradually work your way to the more difficult activities. Problem 3 is the boom-bust cycle. This cycle involves doing too much on good days, which causes an increase in your pain, and then resting too much until the pain improves before repeating the cycle. Over time, you end up being able to tolerate less and less. Instead, you can try this. When you're feeling okay, slowly do a bit more activity instead of doing a lot all at once. And on days when you're not feeling great, try to stay active even if you have a little bit of pain. This helps you increase your activity whilst avoiding the highs and lows of the boom-bust cycle. If you can relate to any of these pitfalls, please let me know in the comments below. Number 4, identify and address other things that could slow down your recovery. Some people with Achilles pain don't see a clear connection between the activity they do and their pain. It's important to think about other things that might be affecting your pain. Let's explore some of these. Body-related factors can impact on your recovery. 2 examples are carrying extra weight or elevated cholesterol levels. Even very small changes in your weight might help your recovery. Elevated cholesterol may be managed by diet or exercise or seeking help from a doctor. Your emotions and thoughts can also affect how well you recover. Negative thoughts like "I'll never get better" or "I might hurt myself if I'm active" can hinder Achilles recovery. Celebrating small improvements can help, and educating yourself about the condition can lessen worry. Also, daily life stress may disrupt your recovery routine or heighten pain sensitivity. Effective stress management varies. Some people find relief in low-impact activities like swimming or cycling. Others prefer yoga or meditation or may need professional guidance. Your social environment and lifestyle habits can also play a role in your Achilles pain recovery. These factors include inadequate sleep, limited support, and stress from relationships or major life events. Some people need help from friends, family, or professionals to address these challenges. Number 5, building strength and confidence with calf exercises. Simple calf and Achilles exercises can be effective for building strength in weakened areas. The key is intensity. Many people don't exercise intensely enough to significantly strengthen the tendon. Additionally, these exercises boost confidence and reduce worry about engaging in activities. Here are 2 exercises, each taking less than 10 minutes a week. Toe stands. Start with both feet. Then progress to 1 foot, hold for 20 seconds, repeat 5 times with a minute's rest in between, targeting an 8 out of 10 intensity. Progress by adding weight, and for most people, this is up to 20 kilos or more over a 6 to 12 week period. Aim for 5 to 6 sessions per week. The second exercise is calf raises. Begin with double leg calf raises on flat ground, progress to single leg, then over a step, and finally with added weight as described already. Do 8 to 12 repetitions in 3 sets with 2 minutes rest between sets 3 times a week. Some people with insertional Achilles pain find lowering their heel down over a step makes the pain worse. However, it's fine to do this when the pain is low, but do it gradually. Remember, not everyone improves with calf exercise, but you also can't expect to improve if you don't do them properly. Did you increase the intensity enough, aiming for 8 out of 10 effort level and adding weight? Were you consistent over at least 12 weeks? Did you modify activities enough if they were painful? If not, this may explain why the calf exercise you tried didn't work. For some people, moving on to sport-specific training like running faster and jumping is needed. Begin these when your calf strength improves with the exercise I described above, and increase the intensity slowly. It's okay if there's a bit of pain, just like we talked about before. For more tailored information about these progressions, check out the links in the description below. Here's how you can schedule your exercise into your weekly routine. Do isometric exercise almost every day, adding calf raises 3 times a week. Schedule progressions of running or walking on different days or at the start of your calf workout when you're fresh. If you are progressing to sport-specific training, like fast running and jumping, do it 2 to 3 times a week instead of the running. Here are some simple and affordable treatments that may alleviate your Achilles pain. While not everyone needs them, they're easy to try and could offer relief. Wear supportive shoes like trainers. Try shoes with a slight heel. Consider using wedges inside your shoes. Apply heat or ice. Try medication like paracetamol or Tylenol, but see your doctor if you're not sure these are right for you. You can also consult a health professional for massage or other treatments, but remember, none of these should replace the top 5 treatments I've listed above. In part 3, we will cover some crucial information. I'll provide a realistic picture of what to expect along the way and tips to help you stay on track. It's crucial to have a clear understanding of what recovery from Achilles tendinopathy looks like. For most people, returning to activities they enjoy, like running and walking, is entirely realistic. In long-term studies, some people still have pain even after 5 to 10 years, but it's not nearly as bad as it sounds. Your pain is very likely to improve over time. But some symptoms, like the pain you experience when you first start to move, or tenderness when you squeeze the tendon, can linger. It's really important not to see this as a failure. It's completely normal. That's why it's important to focus on achieving your personal activity goals. You're much more likely to see steady progress if you focus on this. And returning to activities you love can really improve your quality of life. Remember, these changes take time and won't happen right away. So be patient, give yourself the time you need. If you stay on track, it can take 3 to 6 months, and in some cases longer, to reach a point where you can achieve your activity goals with mild pain. It's important to look for signs of improvement that indicate that you are recovering. They will reassure you that you're on the right track. You should start to see these signs of improvement within 6 weeks. Signs of recovery can include less severe or less frequent pain, ability to do more activities with the same pain, thinking about the pain less often, more confidence in activities despite occasional pain, and shorter recovery times after you have been active. Flare-ups are increases in your pain that can occur during your recovery. They might happen when you're more active, doing new exercises, or sometimes flare-ups occur for no obvious reason. It's normal to feel like you're back at square one or to worry about ongoing pain, but flare-ups are common. Most people experience them during recovery. Here are some tips for dealing with flare-ups. 1. Temporarily modify the activities that have become painful during the flare-up. We talked a lot about this in part 2. 2. If you've recently increased your activity or started something new, consider scaling back until the pain improves. 3. Break your activities into smaller, manageable chunks. This approach helps reduce Achilles stress and can prevent flare-ups. 4. You can use more medications like paracetamol or Tylenol if you feel you need to. Once your pain improves, gradually increase your activity and reduce any extra medication. Some people recover smoothly with treatments we have talked about, but others have more ups and downs. This can happen for different reasons. I've put together a list of common issues to watch out for in your recovery. I'd love to hear from you in the comments about which ones you have experienced. 1. Unrealistic expectations, thinking it will be quick or easy to recover. 2. Overlooking progress, not seeing small improvements which can lead to frustration. 3. Routine challenges, struggling to fit exercise and treatments into a busy daily schedule. Pain, strong pain during exercises which can lead to giving up or avoiding activity. 5. Fear of re-injury, hesitating to fully engage in treatment due to a fear of making things worse. 6. Motivation, experiencing ups and downs in motivation to stick with a plan. 7. Information overload, being swamped by too much or conflicting information and struggling to know what's helpful. 8. Lack of support, feeling isolated without enough support from family or friends. 9. Quick fixes, being attracted to treatments you think will fix the problem, like injections. 10. Misguided treatments, focusing too much on things like massage, dry needling, and other hands-on treatments rather than the sensible, active approach I outlined in part 2. Staying motivated and sticking to your Achilles treatment plan can be a challenge, so here are some easy strategies to help. Make realistic goals. Think about what you want to achieve, like walking or running a certain distance. Choose goals that matter to you and feel achievable. For example, aiming to run 5 kilometers in 3 months may be more achievable than a marathon over the same time. Plan your actions. Decide when and how you'll do your exercises. Pick a regular time and have a backup plan just in case. Track your activity and exercise. Keep a simple diary of what you do. It'll show you how far you've come and help you to decide when you need to make your activities and exercises harder or easier. Get help from a friend. Ask them to remind you and encourage you to do your exercises. A little nudge from someone can make a big difference. So what a journey. You now know why your Achilles tendon hurts and what Achilles tendinopathy is, and why we should not worry too much about what is shown on the scans. We then focused on recovery, discussing how lifestyle changes and specific exercises can help, and what to expect on your recovery journey. If If you need more help, please see the link in the video description. Also, please share and hit the thumbs up if you found this video helpful. Thanks.